Welcome, everyone. Thank you so much for joining us today. We're excited to have you all and definitely excited to be sharing this space as we really think about what it means for us to advance racial healing. I think that this is very necessary organizationally, but also for us to share more broadly with you all, our partners, those that are getting to know Prevention Institute. So we're really excited to have you all here. My name is Laquana Williams, and I'm an associate program director here with Prevention Institute. We are a public health organization who has a focus on health equity and racial justice. And we currently have some core support funding from the Kellogg Foundation to really unpack our learning and journey around racial justice and racial healing. And so part of our process has really been to find ways and opportunities to share that externally. So today is really part of that. So we're so grateful for the Kellogg Foundation for just creating this space for us and so many others around the country to really share about racial healing and what that looks like for all of us. As you can see, some of my colleagues have some hashtags in their backgrounds. You can feel free to use those and tag Prevention Institute on social media, as well as the Kellogg Foundation. We are just going to be sharing a little bit about the work that we're doing and how it relates to racial healing and racial justice. And we developed some questions that we think help to really speak to how we got to where we are on our internal journey, what brought us to this work, et cetera. So we're really happy to share that with you all. And then we want to hear from you. We're going to create some time at the end to just see if there are any questions, comments you all have for us. So please be ready and prepared to add to the conversation. As I mentioned, this is really a transparent process that we've developed. And so we pulled together a set of staff members internally to talk a little bit about their work and its contributions to racial healing and racial justice. And so I'm excited to really just work across our project teams to hear from some great experts in the field of public health and also just here at Prevention Institute and share a little bit more about what we're doing. So one of the first questions I have is a question that I'm hoping most everyone on the panel, if not all of you, can speak to very quickly in about 30 to 60 seconds. The question is, what experiences have brought you to work in public health and racial justice? I'll share that I really came to this work intrigued by having a better understanding of my own personal journey, come from a family who's always been really interested in the health of Black people in this country and across the diaspora. When I had an opportunity to go off to college, that's exactly what I studied. From there, I fell in love with public health because of its contributions and understanding of social justice efforts and how that relates to racial justice. And so it's really been at the forefront of my professional career. And of course, it's something that I hold very near and dear to me in my personal life as well. So that's what brings me to racial justice and public health. I'm going to just go in order of who's on my screen. So I'm going to ask Vince to share first and then sort of popcorn it to whoever you're interested in. Vince?
Thanks, Laquana. Maybe I'll take the opportunity to introduce myself too. My name is Vince Leus, pronouns he, him, his. I'm a program manager here at Prevention Institute, based out of our Los Angeles office in California. So what brought me to working in public health? It was interesting. I came to public health by way of planning school. And I think on one side of my story, I was in my early 20s working as a community organizer, helping immigrant communities in Los Angeles participate in planning department hearings about different projects that were being built in their neighborhoods, because there was a lot of concern from residents around gentrification and displacement. As I worked with communities, we worked with South Asian, Korean, Latino immigrant communities here in LA. I realized how inaccessible these spaces were, and that's really by design, right? Our government processes largely when there is space for public comment or public engagement. They're during the daytime when people are working and they're held all in English. And so, for me, I came to realize that these processes for development of our communities are not accessible to the actual people that live in those communities. And I understood also how much connected health was to community development. And so I came into this work largely because I wanted to ensure that decisions about people's neighborhoods were made by people that actually live there. And I'll popcorn to Lisa.
Thanks, Vince. Hi, everyone. Thank you, Laquano. And yeah, thanks everyone for this opportunity. So I'm mixed race. My mom is a immigrant from Japan, and my dad is white from the US. And I got to give props to them because I grew up with family connection to Asian, white, African American, really diverse families as my community. And living here, living in Japan, my mom being disowned for marrying a white guy, all these things just made racial divisions, racial injustice, racial healing pretty personal, pretty intuitive. And my journey really has involved reconciling my lived experience as someone who doesn't fit into one box, but comes from lineages who have done really a lot of harm to people across the world, recognizing my privileges and really committing to a lifelong journey of understanding white supremacy, other forms of supremacy, and how it lives inside of me, how it lives in my actions, and just continuing to try to unlearn that and learn what solidarity means and looks like.
My name is Kalia Pinnell, and I am a community impact and engagement specialist in our Houston office. We got a rare snow day today, so apologies if we have any internet issues on my end. But I have a background in biochemistry, public health, and health disparities. And so a lot of what I do tries to bridge together the science and the connection and the people within our world. And one thing that we reflect a lot in our trainings is the ancestors whose work we're building upon. And I love to always bring in my great-grandmother and great-grandfather. My great-grandfather served in World War II as a pilot, and my great-grandmother was a really dedicated community leader. And I remember them in the house we grew up in having so many plaques with their names on them, kind of showing how dedicated they were and how much they've really been able to make an impact in their community. And I really have just regretted not being able to meet them. They both had passed relatively early from cardiovascular disease. And I think about all the lost opportunities that I could have been able to kind of pull from their wisdom or have been able to see the bridges across our 4 generations. And I know that that's not unique to me. We know that chronic stress from things like racial discrimination, living through segregation, experiencing and seeing racism, that can cause damage to your DNA, that can weaken your immune system, and that can lead to things like poor health outcomes and lower life expectancies for minority groups. And so I think in my work, what I want to do is understand how that stress impacts people who are living their everyday lives and find ways that we can combat and address those chronic stressors, those external stressors, even like the internalized racism that we hold on to, so that families like mine can see those substantial changes and be able to grow and build memories together. And so that's what I'm bringing into my work. And I'll pass to Dana.
Good afternoon. Thank you, Laquan. Thank you, Alberto, for curating this space for us as an organization to have this very important conversation and be a part of the National Day of Racial Healing with other organizations that are as committed and focused on this work. And I think for me, I'm not unlike the rest of my colleagues here. Dana Fields Johnson, I'm a director here at Prevention Institute. A lot of my work centers on our work in the southern region of the country. I actually live in Florida, which brings its own context to this work, but do a lot of my work in a greater Houston area in Texas. And so and feel really privileged to be able to do this work. And it really stems my desire and passion for this work really stems from my own start in life and personal journey. Similar to my colleagues, I grew up in a southeastern state. I grew up in the state of Virginia. I will tell you, the city that I grew up in, when I reflect back on it, was very racially segregated. My high school, the educational experiences were segregated in many ways. And when I looked around the community, the neighborhood that I grew up in, it was very different from the neighborhood white classmates or schoolmates or other folks that I knew grew up in. And I never quite understood that. But what I did intuitively understand was that we had different resources available to us, that our neighborhoods looked different, and that my experience was different as a Black girl and woman. And this was something I was curious about. And the other thing I think, really innately keen on was that education and the opportunities available really meant the difference in outcomes for young people. I have a heart for youth and young adults, and I, in my journey, have just felt like this is where I want to make contributions. One of the things I've reflected on recently is I've lived in a lot of different states and a lot of different cities, and no matter what I called my work, educational equity work, adult literacy work, maternal and child health work, public health work, the same groups, the same racial and ethnic groups were experiencing disparate outcomes, right? And so, why is that? And finally, I was led to this answer that it's been baked into our systems and our institutions. And so, for me, it's about really wanting to address that, right, at a systemic level, because I really feel we're better than that, right? And we can make progress on these things. So I think, just a hopefulness and a desire to create change, and really that systemic level of change, is what draws me to this work, no matter what I've called it in my career.
Thank you, Dana. Thank you to all of you for just entering into today's conversation by sharing a little bit from your personal perspectives, your individual perspectives. I know that could be challenging at times, but we also know that bringing your full self to this work creates opportunities for others to do the same. And it also contributes just a tiny bit to our own healing and our ability to sustain ourselves in this work as well. Shout out to Alberto, who is behind the scenes today and doing some of our tech work. Thank you, Alberto. We appreciate you for that. So we are going to just dive into the questions that we've developed. Part of what I mentioned earlier is that we want to be able to share with you all a little bit about the work that we're doing around racial healing and racial justice. And so that's what our questions are going to focus on today. Not every panelist will answer every question, so I do want you to know that. But we're going to jump around and hopefully get as much information and content and sustenance from these brilliant people on the panel as we possibly can. So the first question I have for you all is, what components of your work contribute to racial healing? And how does your health equity / racial justice work advance racial healing? So whoever would like to go first in answering that question, the floor is open.
So one project that we started in 2022 in our Houston area work is ESOP's Leadership Network. ESOP stands for Activists Engaged in Sustaining Our Power and Potential. And it was just a nice acronym to pull back to Aesop, the poet and fable writer from Greek times, who reflected on using analogies and ways to use language to form connection between people. And so in 2020, we saw that a lot of our grant partners that we worked with, who were working on the ground, primarily in under-resourced communities who didn't have a lot of access to things like COVID resources. We saw that they were getting a little bit burnt out from that work. But on top of that, we also saw that there were these bubbling tensions from the Black Lives Matter protests and incidences of police killings that had really activated a lot of our colleagues and our peers. We saw that folks were getting tired and traumatized and burnt out because they belong to these communities that are also being impacted, and they're also trying to work on behalf of these communities. And so that's a really hard balance for them to struggle. And what we did is, with these folks that we worked with, our grant partners, we wanted to put together a network where they would be able to connect with each other and talk about what's happening and find ways to not only reset and rest, but also reorganize so that they can stay in motion and keep the momentum going so that their movements don't get halted from them getting too burnt out to continue them. And so with ESOPs, really what we've been trying to do is bake in that racial healing element from the beginning. And so we have a variety of activities that are really pulled together in concert with facilitators who have experience with racial justice, who are experts in their work, like faith-based healing or clinical practice with racial minority communities. And so everything that we do starts with how can we address things like racial discrimination and stress from a lens of cultural competency and making sure that we're not, I would say, whitewashing what true self-care and wellness looks like. So that we're not just saying, go meditate for 5 minutes and you'll be fine, you can go back to the work. But how do we really put together spaces where folks can be vulnerable with each other and learn from each other about how to keep the work moving forward in the future? And I think we always like to use not just kind of facilitated, structured activities like journaling, exercises to help them think through what they need in order to move through burnout or find ways to rest. But we also give spaces where it's just unstructured time where we just have lunch together or we listen to music together, because even those spaces of just being together have been so rare since we went online from the COVID pandemic. And so finding ways to be back in person and get those points of connection where people are just allowed to be people and not think so much about the next grant they're fighting for or how their work might be affected by the incoming administration, but really just giving them that space where they can connect with each other has been really important. And I wanted to bring in a quote from Angela Davis from Freedom is a Constant Struggle that says, "It is in collectivities that we find reservoirs of hope and optimism." And so really, I think that's the goal of ESOPs, is to create those reservoirs, those spaces of hope and optimism that can keep us going in between all the struggles that we're facing.
That's really great, Kalia. So much of what we've learned from our social justice movements is the importance of rest and rejuvenation and what that looks like, and having a better understanding of what it looks like to do that collectively as well is something that I think we are learning. So thank you for sharing. Anyone else interested in answering that question?
Yeah, I think I would be Laquana. One of the things that people look to Prevention Institute for is to support them in thinking about how they are approaching really complex issues around addressing health equity. In our own journey, we've gotten really explicit that we can't do that without talking about racial justice. A really poignant messaging and calling that out and doing that over and over again internally to ourselves, but also in conversations where we hold a very privileged space with philanthropic partners, with others funding city, state, county governments funding the work, is someplace that I've found that we are contributing to racial healing. We are being really explicit. We are saying, if you want to work with us, here is how we're seeing this issue of health equity, right? Something that can be very broad, right? But it can also feel very neutral, right? We've moved past that neutrality to say we have to call out racial justice and the importance of that, and that this work is also healing. And so I think in what we talk about as our communities of practice work, one of the efforts that I've led and worked with is our work in Houston. Kalia has also been a part of that work, where we've worked with the Hogg Foundation for Mental Health to support 10 community-based collaboratives to think about mental health and well-being, but for historically excluded groups. And that's their term. That's how this group of partners, 10 community-based collaboratives across Greater Houston, have wanted to talk about it. Some of them have defined their historically excluded group through race and ethnicity. Some of them are supporting neighborhoods that are primarily African American or primarily Latina, or others are thinking about it in terms of issues and how they disproportionately impact Black and Brown communities. So, for instance, our partners in Galveston, Texas, have looked at how school disciplinary policies have disproportionately impacted Black and Brown kids in Galveston, and how that then further disadvantages them in their outcomes throughout their lifespan. And they've been able to use data to present that case to their school board, right? And they've engaged community and resident leaders and even youth leaders, right, to take up those causes and to be able to feel comfortable and confident exercising and using their voice and power, right, to talk about these things. And they talk about these things as being healing, right, to their communities, right? So for me, it's about us just opening up spaces, right, to for hard conversations and for communities, right, to really say, this is what we need for healing, right? And a lot of times we're talking about also supporting them and advocating, right, for policies that help their communities be healthier, that help their communities be more resilient in hard times, right? But also help them have more equitable opportunities to thrive. And so that's one of the ways I see our work as contributing to racial healing, right? We're just using our voice, our position, our privilege to push these conversations, right?
Yeah, I mean, I think what each of you are sharing is about ways that we are creating space, opening up ourselves and the possibilities so that we can invite others into the fold, which I think is really part of the method that public health as a field and as a discipline is trying to embark on more holistically, to say that public health doesn't necessarily have to be at the center of the work, but that we want to be a partner, a convener in a way that allows us to hear from and then unpack and digest what it is we're understanding and learning, and then to reflect that back into the world. So I think the examples that you each gave are really beautiful examples of the ways that that's showing up in your work.
When I think about racial healing, where we find ourselves early in 2025, right, has all of us reflecting a lot about how we want to show up, right, in the world, right, in our families, for the young people around us, for our communities, and for us here and our colleagues, how we want to show up in this work, right? I think so much of racial healing, right, is about making sure the experiences of all people, right, are heard, right? And we see this kind of push to ban books, right, that really are about acknowledging the experiences of so many communities, right, and people. Those types of things aren't helpful. And so I see us really opening up these spaces, right, and letting people come to the table and not telling them or offering what we need to be talking about, but letting them tell us what the issues are and what needs to be talked about, and determining agendas, right? But just creating those spaces for those difficult conversations around things like historical racism, historical and present day traumas, right? We and still in many ways experience systemic harms from the systems that we all rely on and are connected to. And I think if we can really be courageous, right, and have those conversations in really transparent ways, and then hold ourselves accountable to action, right? I think we will see more progress. And so that's just something I see that being such a huge part of our role and our contribution to racial healing in communities.
Yeah, I think you're absolutely right. And part of what you're highlighting too is an ability to continue to wrestle with the tensions of racial justice and how significant that is for racial healing, to be willing to be in the ring on this and, to not necessarily throw in the towel when there aren't very obvious quick wins. I think the answers that both you, Dana, and Kalia have provided for this first question dovetail really nicely with the second question. And I'm really interested in hearing from Vince on this and Lisa as well, and Dana and Kalia also, but just wanting to make sure that we kind of spread the wealth here. The question, and that's the wealth of information that's flowing from each of you and wisdom. The question is, how has our work at Prevention Institute expanded our partnership so that we are increasingly more inclusive of groups who work at this intersection of public health and racial justice? So I think that there's some recognition here in this question that we have a very traditional sort of public health audience, and that there's some opportunity to bring others into the fold who may not necessarily see themselves as public health practitioners. I love that each of you all shared that you come to this work through different avenues, and in some ways, maybe even found yourself working in a more traditional public health space. So what does it look like to be more inclusive of those groups? And in addition to that, what's really working well and what's challenging? So 2 parts to that question. And whoever would like to kick us off. Vince, you want to go first?
Sure, I can go first. I was just jotting notes based on the question. I primarily manage our statewide policy work, which includes our legislative advocacy, as well as getting to staff the different coalitions that we support and have the privilege to be a part of. And so when I think about how we've expanded our partnerships to be more inclusive of groups working at the intersection of public health and racial justice, the first thing that came to mind for me was that we have looked more inward to understand the different factors that contribute to health. And I think what I mean by that is we've really expanded our network of partnerships and the things that we think contribute to our health. And I think a good example of that is in the past year, our policy team has become more involved with the movement to enact reparations policies in California, reparations for the harm caused by chattel slavery in the US. And I think kind of entering this movement and supporting the work of Black-led organizations, it really comes from that place of Dana mentioned the sort of inextricable link between health equity and racial justice, and understanding that we cannot achieve health equity and racial justice. In this past year, we've worked in coalition with Black-led organizations, including the Bay Area Regional Health Inequities Initiative up in the Bay, and the Coalition for a Just and Equitable California, to really understand how its Prevention Institute as a public health organization, as more of an intermediary organization that isn't necessarily working directly with residents, community members, or impacted individuals, how do we leverage our influence, relationships, and resources to support this movement? Because I think in our work, we understand that repair is an important part of racial healing and a step towards achieving health equity. And I think past work we've done, we've really come to understand that to achieve racial justice, there are sort of several components or several steps you need to achieve to do that. And those things being, one, acknowledging and apologizing for the harm that was caused, the specific acts of harm that were caused to specific groups. And then second, not just apologizing, but taking action to repair and provide restitution to those individuals who were harmed by racially motivated acts of harm. putting policies in place and guardrails in place to ensure that those harms and injustices don't happen again. And I think we know from our work that the inequities we see in health, the inequities we see between different communities, different racial groups have a lot to do with race-specific, race-based policies that were meant to neglect, that were meant to disinvest from communities of color in the US. And I think that is sort of our entry point to understanding that reparations is an important part of achieving a future where all people, regardless of their race, can achieve their optimal health and well-being. And so kind of entering this work again, I think we come to this work wanting to really support and follow the lead of Black-led organizations that have been leading this work for years and decades, really, in the movement for reparations. And so I think we approach the work with a commitment to listening, a commitment to moving in lockstep and in collaboration with Black communities who have been most impacted. And so it's been a real privilege to work in this space. You know, it hasn't been perfect, and we've learned a lot along the way. And so I think continually for organizations that are maybe not rooted in a community of color or a place-based organization, I think the challenge for us is to continue to think how we show up in support and in partnership. Yeah.
That's really great, Vince. I mean, when you're talking, I'm hearing about ways that we've identified for ourselves as an organization to really step up and be of support, and when we need to really step back and be in a listening mode and learning mode. So, it's really great to hear that. And then I think what I'm also hearing is about process too, and the importance of process in this work, because of course we come into everything with our own processes, right? But being excited about engaging in processes that are not necessarily led by us, or even are not coming with like a full health related lens, I think we learn something in part from being committed to that process and being committed to that work. So that's what I'm hearing coming up from you. Thank you for sharing that. Lisa, is there anything you'd like to add to that question as well?
Sure. Thank you. I think it's really building on this question of how we show up. So thank you, Vince and Laquana, for framing that. And that's kind of where I was going to, as well, is that it's not just who we partner with, but how we partner. And in fact, how we partner is in large degree going to determine who's going to want to partner with us. And really, like this phrase of moving to ecosystem approaches instead of empire approaches, that we want to be a part of a flourishing ecosystem that's building, healing, contributing to racial justice. And we're not trying to dominate or, lead in so that others will kind of be under us or follow suit. And I think I'll just say personally, I've really come to embrace the taste of humble pie. I'm like, wow, I wasn't planning on eating humble pie today, but okay. But I think it's probably like just a daily part of my diet now. We're like, okay, now's the time of the day when, for me to do that. But just a story that I want to tell quickly is through our SHINE Safety and Healing and Networks of Equity work, where we have partners in Northern California, including Indigenous communities there, who have helped us go on a journey of really truth telling around the history of the state of California and the United States. You can call it a genocide, you can call it other things, but the state of California paid people to kill Indigenous communities in California. That is the legacy of our state government here in California. The ramifications, the theft of land, suppression of culture, all of these things have caused harm and of course, Indigenous communities are still thriving. And so developing new partnerships to really listen to and respect and take the lead from tribal and non-tribal Indigenous communities in California, come correct in respect and reciprocity. And, it starts with embracing the truth and healing those relationships and then taking transformative action. And it's been influencing so much of what we do in communities we partner with across the state, and also in our state policy. We took up a policy that was recommended by a coalition of tribal organizations around housing. And this was a policy that we learned about through a conference. Prevention Institute got behind that policy, and happy to say that it passed, and it's providing more channels for resources for housing. So those are just some examples of where we are in that journey around safety and healing.
Thank you, Lisa. That's an excellent example. And I love that you started talking about humility in that process as well, because that's a very new space for us to be in as an organization, coming alongside Indigenous groups and being actively in support of the policy change that they've been seeking from the very beginning, and just how much transparency and humility it takes to be part of that process and to sustain the work that we're doing as we're part of it as well. So thank you for sharing that, Lisa. I want to come back to Kalia and Dana to kick us off for this final question. Y'all are just going to start us off, and then I'll come back to Lisa and Vince as well before we open it up to questions from the audience. So the question I have for you all is, what are we learning about ourselves as an organization when it comes to racial healing? What do we now know about ourselves that we didn't necessarily know at the start of this journey? And then if you can, maybe share some impacts of the work that we're doing externally with racial justice groups and how that's really adding and contributing to Prevention Institute's collective intelligence, or what we know about ourselves. Dana, I see you're off mute, so I'm assuming you want to go first.
Always open to offering deference to my colleague Kalia if she would like to start. Kalia, did you have anything burning you wanted to jump with? Or are you okay with
You can
me?
get us started, Dana.
Yeah, I think you framed that in a couple ways, Kwanan. I was ready just to start with this one thing burning in my head about just this importance of, I think the framing around how we show up is so important, right? And the words that come up. I was just really tickled when Lisa said humble pie, right? Because I had to kind of swallow a lot of that too, Lisa, and probably have been with you in a room when we both had to swallow it together, right? I can think about a particular moment, right? And so I just think, I don't know that that's new to us. I feel like we try to show up in spaces with a humble spirit. I know that's something that our staff, in many ways, as individuals, carry. I'm so privileged and blessed to be able to work on the staff that I work, because so many of us come with these passions for addressing social and health injustices. I always tell people the folks I get to work with are so brilliant and some of the most humble people I've ever met. And so I think we feel like we show up in spaces, right, in humility. And then I think what we've learned is that there's still more for us, right? There's still that we are not always the expert at the table. We know what we know, right? How to support folks in bringing a public health lens, a prevention lens, an upstream lens to addressing things like community safety, like mental health and well-being, and how to bring those lenses to addressing things like even substance use and opioid use more and more. But I think what we didn't know is that there are partners, right, out there who bring a stronger voice and lens for racial justice. Like, I am thinking specifically about our work in Houston with our communities of care collaboratives. One of the principles that they really called out early on was to talk about and act on health justice, right? And they were really talking about racial justice and encapsulating it under that term health justice, right? But really, when they defined it, what they were talking about was really pushing the needle on racial justice in their efforts, right? And thinking about policies that advance racial justice in their respective communities, neighborhoods. 4 years into that work that was supposed to be 5 years, we realized of the 5 principles we had called out, that was the one that we had struggled with the most. And when we started asking the resident leaders, the collaborative leaders, why, it was because it was uncomfortable for them to do that, right? And that they felt like they didn't have the language to facilitate those types of conversations in their communities. And when we found that out as coordinators of the initiative, what we were able to do was look at partners who could support us and support them in understanding how to engage in those types of conversations, how to create spaces while holding tensions and navigating emotions that were going to come up in those conversations, how to facilitate those types of conversations. And so I think we have seen ourselves in the past year, year and a half, as we move towards the end of this initiative as we know it, we may be moving into a new phase of it. You know, we've just created spaces to bring partners in who have that language, right? And I think in some ways we've needed that too. Not all our staff are comfortable in facilitating those conversations. And I think that's one of the things we learned when we started calling out racial justice, and that being a part of our journey as an organization and our mission.
Thank you, Dana. Really helpful. Kalia, did you want to add on to that?
Yeah, I'd like to just build off of what Dana said, and that I think in a lot of what we're learning from our projects is how important true relationship and authentic relationship building is to keeping the work moving forward. Because it's one thing for us to go in and say, this is what we think you all need. Did it work? No. Okay. And then we leave. Instead, what we really have been moving towards doing is co-developing and creating spaces with the people doing the work to hear what they think is working, what they think is important to address, and really just getting to know people on that person to person level, because recognizing that the people doing this work are people too. They have their own experiences that they're coming in with, their own journeys and lives and priorities. I think in order to kind of combat the burnout that we see in social justice leaders and activists, is really coming back to recognizing the person behind these movements and being able to support them and provide resources so that they can keep the work moving forward. And we can keep it all moving together, like Lisa said, recognizing that this is all part of an ecosystem and identifying the partners that can be those courageous visionaries to keep moving things forward, while others may need to step back and rest for a bit.
Thank you, Kalia. I feel like we've learned so much already from the work happening in Houston, and just I'm really appreciative of the work taking place there, especially given the context of the state. Always excited to learn from the work you all are doing there. Lisa, Vince, anything you all interested in adding to this question about what we're learning about ourselves as an organization in doing this work?
Yeah, I think what came up for me with the question, the work that we do to advance health equity and racial justice, whether it's through our policy work or through the ways in which we're working directly with community-based organizations, we're dealing with really deep wounds in our community. And we're also dealing with really, really deep wounds that individuals have from the systems that have harmed us. And so I think coming to Prevention Institute right in 2020, I really appreciated the way PI made space and created an expectation that folks on our staff are also taking care of ourselves. So I think an important part of racial healing is that we're also providing the space to rest, heal, restore ourselves, because the work that we need to do, we're doing it for the long haul, and it's going to take a long time to repair and reverse the harm that has been caused and the harm that is still continuing to be caused. So if we want to be able to show up for the people that we work with and be able to provide our whole selves to the work we do, we also need to take care of ourselves too, and take care of one another.
Yeah, excellent reminder, Vince. We appreciate you. Lisa?
I'll try to keep it brief because I just really want to echo what everyone has said around the need to do the inner work. That if we want to act differently, it's processing lived and living experience and resourcing ourselves to be able to show up differently and sustain that. And I also just really want to acknowledge that it takes real listening to leaders of color and building multiracial organizations that can do that well. And just, want to thank again, Laquana and everyone here in our health equity and racial justice team for stewarding this work.
Thank you, Lisa. Great reflection. We appreciate that. I think we want to go ahead and turn it over to you all to see if there are any questions or comments you all have for the team. And then I'll leave us with some closing words. Alberto, if you can let us know if you're seeing anything in the chat or how folks can unmute themselves or type their questions into the chat, that'd be great. Feel free to drop any questions you might have. So please go ahead and type your questions into the chat if there are any coming up for you. And while we're waiting on that, is there anything burning that someone wants to add that they didn't maybe get a chance to share early?
I do. Surprise. I heard us talk about how healing is relational, right? I heard us talk about the need for multiracial alliances, right? To support leaders of color. I heard the need for us to show up in spaces with humility, and all of those things are so important. But I want to call out the need for patience and perseverance too, right? Because so much, I think, of the journey is about sitting in tension and conflict, right? And that's so important to get to the community transformation, the individual transformations, the things that are going to happen to get to racial healing. And I think it was Vince who called out, just historically how far back some of this has happened. And it keeps happening over and over. And so it's going to take a lot of time, right? And I just hope people are committed and that they approach it with patience, and that in our work, we are committed long term, right? That it's not just a 3-year project or a 5-year project, right? It's not even a 10-year project that is going to get us to the type of change we're seeking. And so we just have to stand, right, with courage, I think with conviction and impatience. And that I just needed to say that. I'm sorry.
No, don't apologize. That's beautiful, Dana. Really appreciate you for sharing that. I'm not sure if I'm seeing any questions just yet. Just some thank yous from folks in the audience, and we thank you all for participating and being part of this as well. Dana, your comments lead me to thinking about one of the final things that I wanted to share on this webinar, which is, as we wrestle with our understanding and practice of healing, part of what comes with that as well is our opportunities to trust. And Prentice Hemphill does a lot of work around trust. And so I just wanted to share something with you all from them that I've really been meditating on. Prentice says, "What does change and upheaval reveal to us about who we are and where we want to be?" They say there is an opportunity to stay with trouble in a way that will grow and mature us. If we've trusted in relationships, people, institutions, etc., for so long, and that trust has been violated, then we can decide two things. One, we can decide that where we've extended our trust is it has proven untrustworthy, and that trust is no longer worthwhile. And everything is suspicious because there is an erosion attempting to erode the very practice of trust. But there's also another way. This is an opportunity to heal the ways that we trust, to not overextend it, to not offer trust to places and people that don't deserve it. But nor is it a time to withhold trust where trust is worthwhile. We don't have to do away with trust. We can become more skillful in how we apply it. And we can eradicate the relationship of forced or inherited trust so that we can become more precise in our practice. And I think that's a really, really beautiful segue for folks who are struggling to think about how do we get to healing, right? There are practices that we must put in place that help us to take incremental steps towards truth and reconciliation and healing. Dana, thank you so much. It looks like you dropped a resource from Prentice in the chat, a book that's currently out. So if you all are able to take a look at that, we encourage you to do so. And one of the final things that we want to share is that we will be sharing some resources with you all in follow-up to this webinar in case you are interested in hopefully continuing to be on this journey of racial healing and what that looks like for you individually and for the folks that you work in community with. With that, I want to say thank you all so much for joining us this afternoon. We really appreciate you and hope that you're taking really good care of yourself. And we'll see you soon. Bye.
Thank you.
Laquana, thank you all.